George Kilpatrick Inspiration for the Nation, celebrating people we feel good about. May is Mental Health Awareness Month. And so we're checking in with our partner and sponsor, Syracuse Community Health, to talk about the resources available not only there, but in the community and what the issues are that we as a community are facing. We're pleased to be joined by Zarina Rashid Smith. She is a nurse practitioner at Syracuse Community Health. Zarina, welcome. And
Thank
so
you.
what are you seeing right now in community?
Um, a lot of people are struggling, which is contributing to mental health. Um, Struggles in the community, include food insecurity, poverty, difficulties with transportation. All of this is impacting mental health in terms of stress people are experiencing, symptoms such as chronic worrying, difficulty sleeping, sadness, irritability, edginess. Um, So we're seeing that in the psychiatric department and in regular primary care.
And what do you attribute that to?
External stressors. So mental health can be caused by kind of a biochemical where the person has an internal, like a disease like bipolar disorder or schizophrenia that they're born with, or it can have more easily identifiable causes, such as psychosocial stressors. Um, Somebody who's living with limited resources or in poverty has reasons, very good reasons to be sad or worried or have difficulty sleeping. And it affects all impacts of their life, including their health.
I was, and what about race as a issue for mental health um, and how that impacts our feeling about ourselves? Racism, I should say.
Chronic systemic racism, and chronic daily micro as well as macroaggressions it's a chronic stressor, and stress impacts mental health. Um, the studies have linked chronic stress. So I'll address it in a couple of issues. Chronic stress can cause things like high blood pressure, diabetes, obesity, heart disease. And because of the socioeconomic situations associated with race, disproportionate numbers of people of African American descent have these diseases. I mean, people of African American descent have a different level of access to care. We know that, so we see diseases at a more advanced disease state, which is difficult. There are different, unfortunately, because of our country's history, African Americans have very valid reasons to not trust the medical establishment. So that's a barrier that we medical providers have to work to overcome. So yeah, I would call it more than race. I would probably say chronic systemic racism.
Chronic systemic racism, and in regard to raising awareness. So let's talk about this particular clientele. A lot of the folks that you might see at Syracuse Community Health are folks coming voluntarily to get that support.
Mhm. Absolutely.
And is it a myth that people of African descent in particular are not seeing the need for or are reluctant to get mental health support?
Mental health support? Um, Not that I've experienced. Not it is a myth because I have worked with our population, our community for many, many years, and many African Americans, including men, have been very open about their struggles. You just have to listen.
Hmm.
Yeah, yeah.
Well, so where did I get this idea and notion that people are reluctant to seek mental health support, right? That they bottle it in, or it's something in our community that we're not accessing. Where did I get that from?
Well, I don't think it's any specific community. I think in the United States there's a stigma against mental health.
Okay.
And I think one of the things we do at Syracuse Community Health, and we're really working on, and I've noticed personally, is my patients see me for a primary care visit, but often I'm also a psychiatric nurse practitioner, and it's amazing how much psychiatric practice we do in a primary care visit. People
Mm-hmm.
are not comfortable saying they're coming for a psychiatric visit at
Mm-hmm.
all. And people's needs are so high that they may need their blood pressure medicine refilled at the same time they need to talk about some ongoing stressors they have.
Mm-hmm.
So I think people don't prioritize going to the doctor for mental health as much as they do for something measurable like high blood pressure.
Right. Okay. See, I'm on the right path here, though.
Yeah, I don't know if it's any specific community though. I think it
That's all
might just
across.
all across the board.
Yeah, all
Yeah.
across the board. But right, and so, but there's been a movement, and it's I think about Terry Williams, who has a book, Black Pain. It only looks like we're not hurting, and people like Charlemagne the God who are making uh, talking about mental health in a way that would be more accessible. And so, one of the things that you and I chatted about briefly before coming on the show today is about just that the intersections about how people may show up, but then you might also notice something else going on. You had a couple of stories.
Yeah, I was just so in psychiatric care, I may see someone for anxiety and depression, but they may be out of their blood pressure medicine.
Mm-hmm.
So our chief medical officer, Dr. Reed, and I see things similarly. So the way I described it to him, and he loved it, is if they're out of their blood pressure medicine, I'm going to refill it. I'm not going to send a message to someone or ask them to call someone. I'm just going to refill it. And even better than that, if the blood pressure looks a little high, maybe I'll even increase the blood pressure medicine and do a little education. Um, if that's where the patient's focused. I mean, they may be too worried about their blood pressure to even talk about their mental health.
Mm-hmm.
And there's a lot of barriers to physical care that cause a lot of emotional stress. So if people can't get refills on their meds and their blood sugars are high, that causes anxiety and distress.
Mm-hmm.
So more than mental health meds, it might just be a matter of making sure the person has their blood pressure meds.
And so these are the
They're
things
very
that,
interrelated.
yeah,
Yeah.
yeah, and so in a recent report, 2021, suicide was ranked as the 11th leading cause of death in the United States. How do we support people before it gets to that point? What are the things that we need to be aware of? What are the things we need to look out for? How do we take care of ourselves? And this rapid fire 20 questions, Zarina, because
And they're not easy.
I know. All right, so I'll stop right there because I have more. Go ahead.
We have to take care of each other. People are amazingly resilient. So I have met a number of people who are living in terrible situations who have this inner resilience. And so we have to help people find that in themselves, help people find community supports, help people learn how to access community supports. When people come to us as mental health providers and are struggling with things, we have to provide validation that they are indeed going through a really hard time. The world is not a fair place. This is difficult. We were talking, I believe, earlier about some of our patients, our community living in neighborhoods where there are gunshots every night. And and people saying things like, well, I'm used to it. And you and I were saying, no one's ever used to it. It's never going to be normal. It's not okay that it's this way. And even validating with people, I'm sorry that you have to live like this. It's not okay that it's this way. Rather than, again, well, you'll get used to it. It's okay. That's just, you just have to work harder and get a better job. Supporting people and validating their struggles.
and
But that's an easy answer, and it's not. I wish I had the real answer.
But and here's the T word. I'm about to use the T word, Zarina.
I don't know what the T word is. Terrible?
No. Trauma, right?
Yeah.
That many individuals may be living and dealing with unresolved trauma, maybe because of the conditions. So see, the environmental conditions where they're hearing gunshots. Or I remember when I was doing some work in one of our schools, and the kids were saying that for them, getting to school and navigating all of that, what they have to navigate to get to that front door, was a lot. And if we're not giving young people the space to express that, or even they grow up not knowing how to resolve some things, it's a burden that they might carry. Speak to that. And the word is unresolved trauma.
Unresolved trauma could also be described as unmetabolized grief,
Mm.
unmetabolized rage,
Mm-hmm.
because there's a lot of there's a lot of grief about the life that could have been. People are born into circumstances that just aren't nice, surrounded by people who, it's intergenerational trauma, unresolved trauma that's also intergenerational. Yeah, passed down from generation to generation.
And I might not know that I'm experiencing that. So how is that recognized and how is it healed?
Sometimes it's recognized by people when they're explaining a situation to me and I'm saying, that really sounds awful. And they'll say, oh no, I'm used to it. And I'll say, are you? It sounds tough. And how is it resolved and healed? Um, it's hard to heal it when people are living in a situation with ongoing trauma. So we
Yeah.
just try as much as we can to build the supports, seeking out whatever resources are available, specifically housing,
Mhm.
safe housing and food security. I think those are the biggest. So any projects the community's working on for safe, affordable, secure housing impacts health very, very much, and food security. So that would help. That is what helps heal trauma, is getting people into safe housing that they can live in. Um,
What's the difference then between, we're talking with Zarina Rashid Smith. She is a nurse practitioner at Syracuse Community Health. And can you just talk to me about what the difference might be between I just need therapeutic support and I have a mental health disorder?
is there a difference?
Oh, okay. I don't know. That's why I asked you.
Yeah, is there a difference?
Mhm.
So the two illnesses that jump out at me are schizophrenia and bipolar disorder, which are very clearly genetic and present a very specific way and have very clear guidelines. And when
Mhm.
you see it as a psychiatric provider, you see it, it's very clear.
Mhm.
Everything else is really gray. Um, and even to that, everything in psychiatry is very gray. So I don't know where the line is.
So are there, I mean, we hear about the controversy around HDHD, and things
What's
of
that?
that nature.
I don't know what that is.
I'm sorry, ADHD. I don't know if I
Oh,
said it right.
ADHD. Yeah.
Yeah, I think I missed
Yeah.
ADHD. Yes, attention deficit hyperactivity disorder. Um, controversy around that. Some people say it's caused by certain medical things. Talk to me about um, how do we know if how do we know that what the warning signs might be, or even in my own self, can I see some things that are going on for me that might require some attention medically?
In terms of ADHD or in terms of any mental?
So I was basically giving you two different things.
Okay.
One, um, what about things like ADHD and what what there might be around that, and also what might be some warning signs that I might look for, not necessarily about ADHD, but just in general. What might be some warning signs that, hey, I might need to check that out?
Okay. So ADHD is a childhood and adolescent disorder, difficulty sitting still, difficulty focusing, being really fidgety, blurting out answers in the classroom, or being inattentive and daydreaming a lot. And it's a true disorder. Unfortunately, trauma and ADHD look alike.
Mm-hmm.
So it takes a skilled clinician, of which we have many in Syracuse, to just tease out what it is. Because if somebody has trauma and you give them medicine for ADHD, it's not really going to help.
Mm-hmm.
So most of the pediatricians I know are well versed in this. Sometimes educators, unfortunately, think there's a medicine for it, mainly probably because it's so hard to have a classroom full of kids who are struggling. So that's the controversy with ADHD. It looks like trauma, and trauma
Mm-hmm.
looks like ADHD. You can have one, or you can have the other, or you can have both.
Right. And
Or you can just have an immature kid, you know?
yeah,
Yeah.
right. And a lot of that has been, and so a lot of families in particular, especially for Black boys, this becomes an issue, right? Talk to me.
Behaviors. Well, I think for Black children who may tend culturally just to be a little louder and bouncier and happier, it's a behavior that is seen as needing to be controlled. It's also a perceived behavior, because when I worked at Fowler High School, this is a personal story. When I worked at Fowler High School, the girls at Fowler High School were described as being very loud and this is how they are. But then my daughter came with her friends after school one day, all white girls, and they were equally loud. I mean, there was no difference in the volume. The only difference was the skin color. So
Mm,
the way people are perceived a certain way.
got it.
Anyways, that's a sidebar. That's a sidebar.
Right.
So the way people perceive people of color as somehow being a little bit louder or moving around a little bit more or needing to be a little calmer. I don't even know it's something culturally Black people may be doing. It's something that other people are perceiving.
And right. And,
Because my daughter is just my little white daughter is just as loud as any young Black lady I've seen, and just as bouncy and just as silly.
but that's not ascribed to her.
No,
That
no,
characteristic.
it's not
No.
ascribed to her, but it's the exact same behavior. It's not even like it's a different culture where Black young women are, more active or screamy. I mean, honestly, my daughter was louder. But she's white, so she's going to be perceived as quieter and better behaved. And so then I don't know what we're medicating, because it's not even a different behavior. We're medicating a skin color.
Right.
And that's depressing.
No, it really. And so, Zarina, tell me about. And I talked about warning signs. What about if I want to check myself out? Like, how might I recognize when I might need some help?
I think so everybody is going to be sad some of the time.
Right.
Everybody's going to have emotions. Everybody's going to be sad some of the time. If you're sad more than half of the time, or if you're sad to the point that it's interfering with your life, or other people are noticing and saying, you're not like yourself.
Mm.
Um, yeah, everybody's going to worry about things. If you're worrying so much that you can't enjoy other things, I mean, the one of the things with mental health diagnoses is it impairing your function? Is it getting in the way of you doing things? So if you're so worried or so sad that you can't go to dinner with your friends, or you don't enjoy watching your favorite TV show, or things that you used to enjoy you're not enjoying, then maybe you want to kind of think about what's going on.
I think about something you said earlier about access to healthcare, and I work in some of the work that I do. We talk about taking care of yourself and self-care, right? And there's some sort of thing about that. But if I'm in a stressed environment, if my resources are limited, can I even think about or have the vocabulary for, quote, taking care of myself or self-care that is not in a way that is, what's the word I want to use? That is not, where you're not seeking escape through anesthetization of substances that help you to escape from whatever it is that you're doing.
if you're in a stressed environment and you're pressured all the time, what kind of self-care can you find other than something numbing?
Yeah. That was an easier way to say what I just said.
Yeah, I'm just thinking because I work with a large population who use substances to mask and treat past trauma. Um, the people I work with a large homeless population too. They really seem to enjoy, people really do enjoy being outside. People really do enjoy nature. People, this may just be me, but people really do enjoy being by water. So a lot of people like to stand by whatever creeks are around here. So I will tell people just go be at the park. Whether you using substances or not using substances, it's real nice to be by the water.
Mhm.
Um, um, self-care for someone who's working a hard job and is stressed may be as simple as just having a bottle of water with you so you can drink it so you're not dehydrated and don't feel miserable.
Mm.
Drinking a Gatorade, um, taking a multivitamin every day. I mean, just little things. Um, Staying hydrated seems to be a big problem for everyone. So,
It's a,
if someone,
it's a
if
problem for
someone,
me.
yeah,
I've
so if
struggled.
someone's working, yeah, if someone's working 2 or 3 jobs and they just can't keep up with life, just throwing a bottle of water in their bag and reminding them to drink it is just one small thing they can do. Because I don't want to give someone advice to do something just completely unrealistic that will just make them feel bad that they can't do it.
Hmm. So
Yeah.
yeah, I mean that is good advice. By the way, the two things you suggested, I love water, and sometimes if I'm feeling a certain kind of way, I'll pull up to, I'll go to Onondaga Lake and, or even to the inner harbor, and even to, what do you call it, Ryder Park,
Mhm.
and there's a little creek behind there in DeWitt. Finding little spaces to just replenish.
Mhm.
That's the word. And you can say I have the privilege of doing all of that. Yeah, but even the things that you suggest, because look, we got the creek in Syracuse. Go stand by the creek. Um,
Or the fountain, the Clinton Square
the
fountain.
Clinton
People,
Square Fountain, the
it's
Clinton,
lovely. Yeah.
in the valley. The pond down the duck pond, and so there's a number of different ways that people can take care of themselves. What do you want to leave us with, Zarina?
Oh, so much more.
Well, keep going. Talk to me.
Please, please, Syracuse Community Health is here. We have walk-in care, quick care that's open, taking patients.
Yeah, let's talk about that because you said in Syracuse Community Health, you recognize that people are coming from different spaces, and how do you accommodate that?
Our walk-in care department, is urgent care for quick physical visits, but, all the providers collaborate, and my colleagues there are seeing substance use, mental health. They're educating themselves on what they need to do. They're reaching out for help. They're trying to become more equipped to help people where they're at. So, as we build on this and work to learn, the goal is that people can come to Syracuse Community Health and be met where they're at.
Mm.
It may look like someone, getting a little bit irritable while they're waiting and needing to be calmed down a little bit. We might need to give someone who's upset a glass of water because they're upset. Um, in the adult medicine or the P's department, we might need to accept that somebody's going to be running a little bit late because life's hard. We're not going to cancel that appointment. We're going to say, we're happy you're here. Better late than never. Come on in. Um, so we're trying to meet people where they're at and get them the care they need.
And that's all right. So, how do people get a hold of you? The Syracuse Community Health.
The way that people in the community have gotten a hold of us for the 13 years I've been there is just walking in the door. There are very nice employees at the front desk, security and front desk, who will ask you if they can help you. They'll get you an appointment in whatever department you need. Um, the walk-in care department is at the 819 Salina Street. Most of the other departments are over at the new building, 930 Salina. We have welcoming security and front desk staff to point people in the right direction.
And it's all there for you. All right.
Okay.
Uh, Anything else, Zarina, you want to add to the mix?
I don't think so.
Zarina Rashid Smith, nurse practitioner, Syracuse Community Health. Thank you for helping us understand Mental Health Awareness Month. And the services and support is available at Syracuse Community Health.
Okay. Thank you.
Inspiration for the Nation.